I would check patients' doctor's orders or nursing care plan. I would gather supplies and equipment. I would wash my hands. I'd introduce myself to the patient. I'd also check the patient's two identifiers, name and date of birth. I would provide privacy by closing the door or the curtain. I would explain the procedure to the patient. I would also raise the bed to the appropriate height. So I will be donning and disposing of PPE. First, I would put on the gown, opening towards the back. Secure the neck strings. And then secure the waist. Next, I will put on my mask. Securing the nose area. I would now be putting on my safety goggles, making sure that they were over the mask area. And I would put on my gloves. Wanting the gloves to be over the cuff of the gown. Next, I'm going to be disposing of the PPE. First, I would start with the gloves. Then I would remove the goggles. I would untie the gown, starting at the collar. The bag, you want to touch the inside and pull it down, and while pulling it down, you're rolling it inside of each other. And then I would remove my mask when exiting the room. Final steps would be my post-procedural steps. I would lower the bed to the lowest lock position. Raise the top two arm rails. I would also put the call button within reach. I would assess the patient if they had any additional needs. I would also make sure that they knew my expected time of return. I would dispose of PPE. I would then wash my hands. I would then clean any equipment that came in contact with the patient. I would then wash my hands. I would document the time, date, assessment procedure, and the patient's response to the procedure.